Hello everyone. Today we will be talking about protected versus unprotected left main disease. So as we are aware of, coronary arteries starts on the left side with left main coronary artery, and this left main coronary artery divides into two parts, that is left anterior descending artery and left circumflex artery. So now supposing that any patient has a disease in the left main coronary artery. So supposing there is a stenosis, so we can consider this as a stenosis of this. So there's a lot of stenosis of the left main coronary artery, and this is the stenosis here. Only this flow is available. Now, if you want to intervene to this patient, so this is like left anterior, left circumflex. Now, if you want to put a stent here, now what will you do is first you will do a pre-dilatation, that is you will open this lesion. And now, whenever you have to put a stent, you have to have a proximal and distal a landing zone. That means a healthy zone should be there. So proximal, you have a healthy zone here. So you can put a stent proximal and you can keep it here. I'll show it with the other pen 1 minute. So proximal end you can keep it here. Distal end has to be either in this artery or in this artery. Now, sometimes now what happens is that when you try to put a stent here, supposing we are putting a stent in the left anterior descending in this way. So when you put a stent here, there's a time that because this is all is metal here, so there's a high chances that this left circumflex artery supply may get compromised. Get compromised. So for these things, we need to know what is protected versus unprotected. So supposing protected means nothing, but suppose a patient has a CABG, has undergone a coronary artery bypass graft, and on undergoing coronary artery bypass graft, patient has one graft from the Lima artery, that is left internal mammary artery, from Lima to level AD, supposing a patient has a graft. Now, what does this means is that suppose Lima is being completely supplying the left anterior descending artery here. So, what does mean that supposing that their supply is not there from here to here. That means from left main, if the left anterior descending, if supply it gets interrupted also, already there is blood supply to the lady from the Lima artery. So that means that this LAD is now completely protected. So now you can treat this left main to left circumflex as a single artery. That means that now if you want to put a stent here, you can directly put a stent from here to here. So that means that even if during this process the left anterior descending gets compromised also, it will not affect much, because even if it gets occluded here due to the stenting and all, now the LAD is already being protected by the left internal mammary artery from the graft of this. So this is called as protected left main. So protected left main is, again I said that one of the branch is protected by a graft is called as protected. Suppose it is, what do you mean by unprotected? It means that there is no graft is there, and thus this bifurcation itself is a risk for intervention. So this is important because the unprotected left main disease will have a very high chances of mortality during the procedure, whereas protected will have a very less chances of mortality because the vessel is itself protected. Thank you.